views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to the Bronx Buzz. This is BronxNet's program where we talk to journalists and writers and editors and photographers and filmmakers. And this is the category we're going to put everybody who's on the show tonight in. Anybody who puts something out in the Bronx. We give them the opportunity to talk about what they've put out and give you a little bit, if not a lot of bit, of insight as to what it's all about. This evening, two very important segments. One is going to be about our environment and what's going on in the Bronx as regards justice in environmental issues. And the second part, this is something I'm really looking forward to. We're going to hear from a doctor who served at Montefiore Medical Center in the emergency room through the pandemic, and he's just written a book. We're going to talk about that book. Right now, let me welcome Dr. Lessie Branch, who's the director of the Think Tank at the Thinkubator, and nice to have you with us again, Dr. Branch.
Thank you, Gary. Nice to be with you.
Let's talk about the report you put out. This was a policy brief about environmental racism in New York City, something that unfortunately Bronxites know a lot about. So let's talk about why you did it, and then in general, what the conclusions were.
So why we did it? Well, we wanted to, look at two things. What is the effect of the Bronx environment on youth? And two, what shapes environmental literacy among Bronx residents? And so the Thinkubator, as you are aware, is a youth focused organization. We bring power to youth voices. And so a lot of what we do is driven by the youth. And they were interested in creating this survey and, having residents of the Bronx answer this. And so this is why we did it again, to get a sense of what people's literacy is around environmental racism, and also to look at what is the effect of environmental racism on Bronx youth.
I think that what you did is really interesting and important, because many of us adults, and certainly people like myself, let's say, who are involved in issues, and we talk about issues all the time, we kind of understand it. And maybe when I saw the report, I was like, well, yeah, I know all about it. But your point of view to say, wait a minute, there are young people who hear about it like out there in the clouds, but this is their future, and maybe they can have some input, not to mention that our entire new electorate is going to be young people. What did you find? What was the sense that you got from young people with this policy brief?
Well, absolutely. Overwhelmingly, the Bronx youth are not ignorant of the issues that are in their community. They are very well aware and they are very engaged. And to your point, this is, their future, and they are next up in terms of making the age of enfranchisement where they will have the opportunity to exercise the right to vote. And so in some ways, this is their way, if you will, of holding the elected's feet to the fire. Look, we know what some of the issues are. These issues have a direct impact on us, particularly our health, and we want to know what you're going to do about it. And to help you along, we've even come up with some policy recommendations that we'd like for you to consider.
Yep, we'll review those. There's a photograph at the lead of this report, which really, it tells the whole story. It's so disgusting that I can't believe it's anywhere, let alone in my beautiful home borough of the Bronx. We say, okay, there's environmental racism. Where do you see it? Where's the evidence of it that needs to be looked at in this, with this periscope?
So overwhelmingly, I would suggest that where it needs to be looked at are in the health outcomes. Um, the Bronx, as you are aware, is number 62 out of 62 counties in New York State. And, there are direct correlations that tie to environmental racism and some of the health outcomes that are experienced by citizens and young citizens at that of the Bronx. Highest asthma rates, if not second highest. We have this nice little chart in there that talks about, if you will, some of the health outcomes that correlate with, if you will.
And what makes you think that these are the result of the environment as opposed to maybe another somewhat related but not directly related aspect like access to healthy food or some other factors? What makes you think that it's the environment?
Well, so when we talk about socioeconomic determinants of health, it's all of those things, right? I would argue, and so it's not
Air
uh,
pollution, water
right.
pollution, cleanliness of parks, on and on.
Exactly. And so it's all of those things. And then, coupled with that, it's the access, it's the education, it's where you live. I mean, in the Bronx a couple of years ago, when we had the issue with Legionnaire's disease, it wasn't because people were behaving in ways that caused them to get this. It was an environmental issue, whereas the water towers, as I understand it, in some of the
That's true.
buildings hadn't been cleaned. And the result was a health outcome that resulted in Bronx residents contracting Legionnaire's disease.
I thought what was interesting about the policy brief that the Thinkubator put out used the word racism. Now, we've had many studies that will say environmental justice.
Mhm.
Racism is a much more pointed term. And so, what makes you think that it's a racist thing as opposed to simply an injustice? In other words, that people's ethnicities, they just happen to be on the receiving end. But racism would suggest that there is somebody or some people or some a body that says, you know what, they get and they do not.
So that's a great point. And I would suggest to you that it's racist in that when you look at how race correlates to the issue, there is a strong positive correlation. As you know, the Bronx is predominantly made up of Latinx and or Hispanic folks, followed by Black folks of the African diaspora.
I got the numbers which I pulled out of your report. 56% Latino, 29% Blacks or African Americans, and less than 10% whites. Those are the facts.
Right. And so there's a correlation. And so it's not to suggest that somebody is intentionally being racist. Sometimes racism is not, I can't remember what the term is, but there are,
Systemic. You want to use
right,
that term? Systemic.
systemic, right? And so, but to that point, when we look at how things break down by race, we can't deny the fact that, you know, government once upon a time created these systems that allowed racism to exist. And in some ways, because it is systemic, even though there aren't necessarily racist in government who are perpetuating these things, the systems continue and live on and perpetuate. And so clearly there is a need to, change the systems.
Uh, One thing that came out, and we're going to run out of time, but I definitely want to get to the 4 points that you guys, analyzed and put out, is that you found that most residents who you talked to for this survey believe that pollution has not impacted their lives. That's fascinating. That says to me that Bronxites are like, we're just going to keep going, even though the health numbers, the health indicators, the cleanliness of neighborhoods, as I say, cleanliness of parks, we all know it does. On the other hand, 71% said they support environmentally friendly policies. They're ready to recycle. They want cleaner alternatives for the air. They want to address litter and pollution and more sustainable infrastructure. Bronxites are ready to do this. That's the way I read what I read in your report.
That's true. And they are, and one of the things I love about Bronxites is their grit. And so, with regard to the whole phenomena of climate change, Darren Walker, the president of Ford Foundation's analogy of eating lobster on the Titanic, to me is apropos, right? So if we fail to recognize and acknowledge the origins or even the underpinnings, if you will, of environmental racism or climate injustice, or however you want to name it, we all go under. We all go down. All go under the sea, and not
Nobody's exempt.
right.
That's right.
And so, if we think more broadly, what if and when Earth becomes inhabitable, right? Where we gonna live?
We watch what's going on in the West. We saw that the smog was blowing literally up 3,000 miles across the country. You got to know what's happening. Before we run out of time, I'm going to list the 4 recommendations and then ask you to sum up of how we're going to get there. Promote youth-based input for environmental justice, which you talked about right at the top. Support Bronx policy agendas that increase capacity for green jobs. Again, you talk to Bronxites, they're going to click yes. They're going to vote yes every time. Advocate for green energy development, especially in low-income housing, and restructure the Bronx infrastructure and amend planning. How do we do those? You got about a minute. How do we do those things, or at least start the process that we can address these things that your report articulates?
So I think part of how we started is with the infrastructure bill, right? There are lots of good things in that infrastructure bill at the federal level. I think states could really adopt it, and even local organizations can too. Solar panels on public housing, incentivize people to, buy hybrid and or
electric vehicles. Sure.
There are lots of ways that we can do it. No shortage.
I'm one last thing before we go, which I've been a proponent of, is that recycling. I realize if you look at the numbers, recycling doesn't really affect, the carbon footprint that much, but it engages everybody that it's their responsibility when they separate their food or their garbage. I mean, to me, that's the kind of thing we need to do so that we all realize we all have a role in this. I mean, that's my agenda. The last thing I'm going to say from my perspective, I'm done with the plastic. I'm done with the plastic bags. The fact that we could put a man on the moon, we can create a vaccine in a matter of months, and we can't figure out how to make biodegradable plastic bags is beyond me. Time to get that done. That's Gary's advocacy. That's Gary's report.
Well, yeah, definitely.
I know you're with me. Listen, Dr. Lessie Branch, who was part of the team that put together the Environmental Racism in New York City Policy Brief. Thank you. Thank my friend Eddie Summers, Dr. Summers at the Thinkubator. Keep doing the great work. Keep putting it out, and we'll keep talking about it. How about that?
Thanks so much.
Great. Dr. Lessie Branch from the Thinkubator. All right, we're going to take a short break. When we come back, a doctor from Montefiore Medical Center who wrote a book about what it was like in the emergency room at Montefiore during the pandemic. Don't go away.
When taking public transportation, don't touch your phone. Carry hand sanitizer and use it immediately upon leaving the bus or train. Avoid touching your face. If someone is coughing or sneezing, move away. Wash your hands with soap and water as soon as possible. Limit contact with poles. If possible, avoid rush hour. Don't eat or drink on public transportation. Keep your bag off the floor or other surfaces. Avoid directly touching turnstiles. Stay up to date with the latest from your local health department and CDC. If you're struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit, or call toll-free at 833-511-0311. That's 833 511-0311.
Okay, back with you on the Bronx Buzz. And as I mentioned earlier, I'm thrilled to have this particular interview set up. Dr. Robert Meyer is an emergency room doctor at Montefiore Medical Center. Dr. Meyer, nice to have you with us.
Thank you for having me.
And the author or the co-author of the book, and the book is called Every Minute is a Day, is Dan Koeppel. Nice to have you with us, Dan.
Thanks so much.
As I mentioned to both of you beforehand, having primary sources on the biggest story of our lifetimes is really something you don't get to do that often. And Dr. Meyer was in the Montefiore Medical Center emergency room during, I guess, what has to be considered a war room in 2020. So, Dr. Meyer, give us something. I mean, what are your impressions? And I have to tell you, my thought is, if it was me when it was essentially over, although of course now we know it's still going on, I don't think I'd want to talk about it. I don't think I'd want to write about it. So what was happening that made you say, I got to put out a book? There's something here that needs to be told.
Yeah, well, it's actually just the opposite of what you said.
Really?
We all needed an outlet, every one of us, every doctor, every nurse, every respiratory therapist, housekeepers, you name it, we all needed an outlet. And I never imagined that this would be my outlet until Dan texted me right at the beginning of the apocalypse and simply just checking in on his cousin saying, hey, how are you? And I said, do you really want to know? And he said, yes. And I said, it's terrible. And he said, on a scale of 1 to 10, how bad is it? And I responded 100. And it was his idea. He just simply said, hey, talk to me every night.
We'll bring Dan in a second. You say it was 100 on a scale of 1 to 10. It was 100. I'm thinking that one of the issues was that we didn't have enough information. It all of a sudden descended on us. There was no warning. We were not prepared in terms of equipment. I was remembering in preparation for this, imagine shortage of hand sanitizer, shortage of masks. These are fundamental things that weren't available. Cleanser to keep your house clean or to wipe off doorknobs and things like that. I'm thinking in the emergency room, there was this unknown, like, wait a minute, we've got this. So how much did you know? And was it frustrating simply on an information level to try and keep people as healthy as you could?
Yeah, there were many frustrations. And if you recall, there was the toilet paper shortage, right? So maybe that should have been a clue that, some bigger and badder things were coming our way. But we just turned a blind eye almost. Yeah, it's like we just, I don't know, in the ER, we just felt like, hey, this isn't going to happen to us. And yeah, we were lacking certain supplies in the way of personal protective equipment, but it never stopped us. It never once stopped us from going forward and taking care of people in their time of need. And in large part because of what you said, we didn't know. We didn't know really how it was transmitted, if you touch it, the doorknob, how far the virus goes when you sneeze and cough. At the beginning of the pandemic, we were walking around that ER with nothing on. And we were swabbing people thinking they had the flu and they weren't testing positive for the flu. We didn't, so there was a lot of unknown at the time, like the rest of the world.
Dan, when you realize that this is an unfolding story, and I've been in media, not print as much, but certainly in TV and TV journalism and talk shows for many years, when something is unfolding, it's a challenge because you want to get it right. It's dynamic. It's happening as you're breathing. I mean, something new is happening, and you knew that the stories you were hearing from your cousin were incredible. Talk to me about the challenges and how you address those in terms of writing the book Every Minute is a Day.
I think it's important to point out that, you know, Rob is my cousin. We've known each other all our lives. We have you know, almost a telepathic communication between each other that comes from that sort of shared blood. You know, Rob, I think it's fair to say, was inspired to become an emergency room doctor by my father, who was an emergency room doctor, who mentored him. So there's a real closeness and understanding. And so my text to him initially had nothing to do with writing an article or a book. It was really, you know, I was worried about him. And then when he started telling me the stories, you know, then the nose for news clicks in, and you start saying, this is really important. It's not just like, wow, there's a book, we could have a big book, we could make money. It wasn't that. It was that Rob needed to tell the story, and I wanted to help him, and I knew it was a good story. And you know, we talked on the phone, we did traditional interviews, he sent text messages, he left voicemails, and it was an assembly. And it went in chronological order, pretty much.
Are you pleased now with the result? I mean, and there's something that I really want to get to, which we're going to do in a moment. But did you feel like you captured? I can't even imagine thinking about it, let alone trying to document it accurately with emotion, you know, and all the things that you try to do as anybody who's relating a subject through media.
If you're asking me, I would say this
Go ahead.
was easily the most difficult, compressed, emotionally draining project I have ever undertaken in my 30+ year career, and the most rewarding. And I think the results, you know, I don't want to brag, but I think we wrote a really, really good book, and I think people will see that.
Gentlemen, while I'm talking to you, I'm thinking that maybe because we only have a half a show to do this, that maybe we ought to do something larger with this, but we can do that over time, because the number of questions I have for Dr. Meyer are excessive. The one thing that came out and comes out in the book and comes out in kind of the result of what you put out, and the line is, Meyer finds light amidst the pandemic's darkest moments. I can't imagine that. Talk to me, if you would, Dr. Meyer, about what we learned from this, what you learned from this. You know, how things might be ultimately better as a result of it. There's part of me that can't imagine it, but I'll let you just articulate that, if you would, because I know it comes out in the book.
Yeah, you know, there's so many examples and so many answers to that question. I'm just going to go with the first one that hits me, and that is that the best in people came out. And I can't tell you how many family members I spoke to, whether from home or at work on the phone, that were comforting me. And
Wow.
I will never forget that. They were comforting me, thanking me. Their loved one passed, and they're thanking me. And I will never forget that.
You have been an emergency room physician for a very long time, as I wasn't aware of it. Dan related that it was in your family to be that. You have seen, I'm sure, any number of things that are difficult for, I guess, the regular folks to deal with. In terms of dealing with this, even seeing your colleagues, I'm assuming there were many, I don't want to presume the numbers, but there were doctors and nurses and other staff members who also got it and didn't make it through the worst part of this pandemic. Just talk to me a little bit about where this fits and how you were able to get through it. I mean, to some degree, I think it was probably therapeutic that you were communicating with your cousin and
Oh,
telling him what was going on.
100%. The book was a catharsis
Wow.
talking with Dan, and I availed myself of the psychotherapy, if you will, from Montefiore. They offered therapeutic services, and I had a very unique relationship with Simon Rigo, who really held my hand through this pandemic. But the reality is that we played a game amongst ourselves. If somebody got sick, we ran a list and convinced ourselves that there was some comorbidity, some risk factor that we didn't have to keep us going. Even if they were 2 pounds overweight, we checked it off the list and said, okay, I'm not eating for the next 2 days. I'm keeping my BMI down. It was that kind of survival instinct. We just had to make up reasons why people were having bad outcomes. And I'm very lucky that I do not have a single close contact in my professional world, in my family life that's come to COVID.
Not everybody in America can say that.
And to say that about the emergency department at Montefiore is incredible, because we were in the belly of the beast.
Dan, as somebody who's, we're just about out of time, unfortunately, because we could talk about this for a very long time. As somebody who's been in journalism and writing for all this time, how do you follow it up? You know, I mean, do you follow it up and say, you know what, this is a movie? Do you follow it up and say, well, we got to do volume 2 because after all these changes that might result, better protection, better awareness, making sure we have the items that we need to stay safe. How do you follow it up? What's next?
You know, I have made it a practice in my career to never worry too much about what the next step is going to be. I am happy that we wrote what appears to be a really good book. And when the next good idea comes, I hope I'll be able to recognize it.
I hope that the good idea comes with the solving of this pandemic and the health and the future of all of our the tremendous healthcare workers and all the other people. One thing which I didn't say at the top, Dr. Meyer, for you and for all of your colleagues, we all owe you a good debt of gratitude. We can't thank you enough for your courage, your bravery, for sticking with it when many of us would have bailed the heck out.
No, we really, those comments make us so uncomfortable. We really, we never felt like heroes. We were scared. Heroes aren't scared. And
well, and you know what you did? You exemplified the best of your profession. The oath of becoming a doctor. You said, you know what? It's our responsibility to be here. It's like as large a MASH unit as you could imagine, and you guys did great. Anyway, so the book once again is Every Minute is a Day, and we can only imagine that to be true. Robert Meyer, doctor in Montefiore's ER, thank you so much for joining us. And Dan Koeppel, thank you for writing it. Thank you for finding the words to put to this just incredible story. We recommend the book, and we recommend that you send a nice note to Robert Meyer and tell him, hey, thanks. We love you and we appreciate everything you've done.
Thank you so
much. Really, that is the truth. Both of you, thanks for joining us in the Bronx.
Thank you.
Thank you.
And guess what's going to happen next week? We'll be back with more. You have a good night. Stay safe. Wear your mask. Make sure you're vaccinated. I think that's the appropriate way to end this dialogue in this program. So have a good night. Thank you.